Here are the details that every American needs to know about this plan. First, if you are among the hundreds of millions of Americans who already have health insurance, nothing in this plan will require you or your employer to change the coverage of the doctor you have. Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most. They will no longer be able to place some arbitrary cap on the amount of coverage you can receive in a given year or in a lifetime. We will place a limit on how much you can be charged for out-of-pocket expenses, because in the United States of America, no one should go broke because they get sick. And insurance companies will be required to cover, with no extra charge, routine checkups and preventive care, like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer and colon cancer before they get worse. If you lose your job or you change your job, you'll be able to get coverage. If you strike out on your own and start a small business, you'll be able to get coverage. We'll do this by creating a new insurance exchange, a marketplace where individuals and small businesses will be able to shop for health insurance at competitive prices. Now, for those individuals and small businesses who still can't afford the lower-priced insurance available in the exchange, we'll provide tax credits, the size of which will be based on your need. For those Americans who can't get insurance today because they have pre-existing medical conditions, we will immediately offer low-cost coverage that will protect you against financial ruin if you become seriously ill. This was a good idea when Senator John McCain proposed it in the campaign. It's a good idea now, and we should all embrace it. But an additional step we can take to keep insurance companies honest is by making a not-for-profit public option available in the insurance exchange. Let me be clear, it would only be an option for those who don't have insurance. No one would be forced to choose it. It would also keep pressure on private insurers to keep their policies affordable and treat their customers better. I will not sign a plan that adds one dime to our deficits, either now or in the future. We've estimated that most of this plan can be paid for by finding savings within the existing healthcare system, a system that is currently full of waste and abuse. The only thing this plan would eliminate is the hundreds of billions of dollars in waste and fraud, as well as unwarranted subsidies in Medicare that go to insurance companies. And we will also create an independent commission of doctors and medical experts charged with identifying more waste in the years ahead. These steps will ensure that you, America's seniors, get the benefits you've been promised. And we can use some of the savings to fill the gap in coverage that forces too many seniors to pay thousands of dollars a year out of their own pockets for prescription drugs. Many in this chamber, particularly on the Republican side of the aisle, have long insisted that reforming our medical malpractice laws can help bring down the costs of health care. I know that the Bush administration considered authorizing demonstration projects in individual states to test these ideas. I think it's a good idea, and I'm directing my Secretary of Health and Human Services to move forward on this initiative today. The time for bickering is over. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care.
So let me get this straight. This is a long sentence. We're going to be gifted with a health care plan we are forced to purchase and fined if we don't, which purportedly covers at least 10 million more people without adding a single new doctor, but provides for 16,000 new IRS agents, written by a committee whose chairman says he doesn't understand it, passed by a Congress that didn't read it, but exempted themselves from it, and signed by a president who smokes, with funding. Same sentence. With funding administered by a Treasury chief who didn't pay his taxes, for which we will be taxed for 4 years before any benefits take effect by a government which has already bankrupted Social Security and Medicare, all to be overseen by a Surgeon General who is obese and financed by a country that's broke. So what the blank could possibly go wrong?
Let's face it, folks, the new healthcare reform law is complex. It runs about 1,000 pages, even in tiny print, so it's no surprise that very few Americans have actually read it. But it's about to affect all of us, and many have been wondering what it will mean for our health, our wallets, and our country. Let's say we take all 310 million Americans and squish us down to just 25 people. Yep, each of these folks would represent about 12 million of us, and this is pretty much what we'd look like. Polls show about 3 out of 10 of us say healthcare reform will make us better off. A similar number say worse off. And a similar number again say it won't make much difference at all. Some of us don't know what to think. I guess you could say we're kind of split on this one. But no matter where you stand on the issue, it's likely you're thinking, hello, I got some basic questions still unanswered here. And you deserve real answers, not the partisan rhetoric and spin we've been flooded with. So let's break down what the reform law does and doesn't do and what it will cost. If you want to read the whole law, go ahead, but watching this video is the next best thing. Ready to jump in? Let's begin with the problems in our current healthcare system. Problem number one is what problem number one usually is: money. Most people agree that health insurance policies are too expensive. For a family, the average premium is almost $14,000 a year and growing. Premiums have doubled over the last 9 years, ballooning way faster than inflation. Plus, our population is aging, meaning more people with more health problems. So healthcare costs are the fastest growing part of the federal budget. The second problem is that the system is full of holes, like the fact that people buying insurance on their own can be turned down for having a pre-existing health condition. Small businesses may be charged extra if some of the workers are sick, making insurance unaffordable. And some insurance policies have a lifetime limit on benefits. After that, you're out of luck. That means some of the people least likely to have coverage are the ones who need it most. Nice, huh? High costs and holes in the system mean more than 1 in 7 of us have no health insurance to protect us at all. Many more struggle to pay their bills and can only afford bare minimum policies that may not cover much. High cost to households, strain on the federal budget, and people with no protection. It's easy to see why many people were looking for something different. So here's what the health reform law plans to do in its first phase between now and 2014. To start dealing with cost, insurers will be limited in how they spend our premium dollars. If they use too much for administrative cost or profits, they'll be forced to give some of it back through rebates. This won't stop premium increases, but it may help some. Some services will become free in all new private insurance policies and in Medicare, preventive care like screenings and vaccinations. People on Medicare, because they're over 65 or disabled, will get more help with their drug cost. Young people can save money and stay insured by remaining on their parents' policies up to age 26. And some small businesses will get tax breaks to help them pay for health insurance for their workers. And the holes, well, some will be closed starting now, too. Lifetime limits on health coverage will be gone, whether you buy your insurance on your own or get it from your employer. And it will be illegal to turn kids down for having a pre-existing health condition like asthma or diabetes. Of course, some adults who buy insurance on their own will still be getting rejected between now and 2014. Those who do can enter something called a high-risk pool run by the government. No, it's more like a policy that covers the sickest uninsured people, meaning it's riskier for insurance companies. That's why the government will chip in some money to bring down the cost. Some say these high-risk pools will help a lot of people. Others say the pools will still be too expensive and may not have enough government money to stay in business until they're replaced by something better in Phase 2. On New Year's Day 2014, some big changes kick in. First, let's look at how the law makes health care more affordable. Medicaid will be expanded to cover all low-income individuals and families in every state. And depending on what you make, if you lose your job or your employer doesn't provide decent coverage, you may get a health insurance tax credit. And while most of us will continue to get health insurance at work, just like now, if you don't have that option, you'll be able to buy coverage in what's called an exchange. You'll be hearing a lot about them, so let's stop and look at how they work. An exchange is like a virtual insurance mega mall. Based on where you live, you'll get an easy-to-understand menu of options to compare plans in plain English, and the exchange makes sure insurance companies compete fairly under strict rules. The idea is that by giving consumers good information, a fair playing field, and access to lots of choices, competition among insurers will keep rates competitive. Now, on to plugging the holes. In 2014, insurers will no longer be able to turn people down or charge them more if they're sick. You might say, hold on a minute, if I can't be turned down or charged more, why not just wait until I get sick or injured to buy insurance at all? Not so fast, buddy. See, with few exceptions, people will be required to have insurance or pay a special tax. Same with larger businesses, who will pay fines if they don't insure their workers. Of course, nobody likes being told they have to buy anything, but without this rule, experts say you can't require that everyone be eligible for coverage. Imagine telling home insurers they have to cover people whose houses are already on fire. So the government will provide credits, expanded programs, and new rules. They say that by 2019, 32 million of us who don't have health insurance will have it. Some of those who will still be uninsured, undocumented immigrants who aren't eligible for coverage under the law. No surprise, all this is going to cost money, $938 billion over the next 10 years, according to the Congressional Budget Office, the impartial referee when Congress debates these kinds of things. It's a lot of money, sure, but if you look at it another way, it's 2% of our federal budget and 3% of what we'll be spending on health care overall. Now, the President and Congress insisted these new costs will be paid for so they don't push the budget deficit up any further. That means money will come out of someone's pocket. What? That's where the tough politics come in. A lot of savings will come from health care providers and insurers in the Medicare program. The fees the government pays to hospitals under Medicare won't be allowed to rise as fast as they have been. And insurance companies that provide services to people on Medicare will be paid less. Medicare will also create a bunch of experiments around the country to test different ways of paying doctors, hospitals, and other providers to make the healthcare system more efficient and improve the quality of care. With luck, some of these experiments will work and then be adopted by the private sector and help lower costs for employers and families, too. Plus, a new federal advisory board will make recommendations about other ways to deal with increases in healthcare costs. Some taxes will go up, too. People with high earnings will pay higher Medicare taxes. There'll be new taxes on insurers and businesses who offer high-end benefit plans and on companies that make medical devices and drugs. And, anyone who visits a tanning salon now has to pay a new tax, too. With these new cost-cutting measures and new taxes, the Congressional Budget Office says the whole package will actually reduce the federal deficit over the next 10 years. Of course, the total federal deficit is expected to run into the trillions, so the health reform law isn't going to solve that problem. Well, that's the reform law. Do you love it? Hate it? Still don't know? Either way, there's still a lot of work ahead. You'll be hearing lots of different things about this law. Some people support reform and, if anything, want to expand it and increase government oversight of insurers in the healthcare industry. Others oppose it and think it creates too big a role for the government. Some states have even gone to court claiming the requirement that everyone buy insurance is unconstitutional. Politicians and pundits will be talking to you as if you've got no idea what's in that 1,000-page law. But by watching this, you're on your way to getting informed, and you can make sure your friends and family are too, just by passing this little video around.
By now, you've probably heard a lot of conflicting information about the ACA. That's the Affordable Care Act, also known as Obamacare. I'm here to clear things up a bit. For the younger of you out there who don't know how health insurance works, you pay the insurance companies monthly, and if you ever get sick or injured, they will pay or help pay for your medical bills. Unfortunately, what had begun to happen is that health insurance companies were charging more and more while putting out less and less, or were looking for more excuses to not pay. What Obamacare does is put rules in place so that health insurance companies can't take in too much more than they put out. The aspect of Obamacare that's drawn the most controversy is the fact that if you can afford healthcare but choose not to buy it, that you have to pay more in taxes, essentially mandating that you buy health insurance. Although the idea of having to pay for this service bothers a lot of people, the same argument could be used against policemen and firefighters. In both cases, you pay for them even if you're lucky or careful enough to never need them. The reason you still have to pay for it is that millions of people could never afford these services if they had to pay for them in a private market. There have been other complaints floating around too, but they're not very grounded in reality. For example, it's often claimed that Obamacare would raise the deficit, but it actually lowers the deficit by about $124 billion. The idea that socialized medicine hurts the quality of care is also false. According to the World Health Organization, the United States is ranked 37th in terms of quality of healthcare, far below other first world countries and well below any country with socialized medicine. In terms of overall health, we're 72nd. There's also a claim that Obamacare cuts billions of dollars from Medicaid. These cuts are actually just increasing future spending by a smaller amount than previously planned. And on top of that, the future benefits that are going to be received have not changed, because the only people who are going to receive less money are the health insurance companies themselves.
The Supreme Court is set to rule on the Patient Protection and Affordable Care Act, or Obamacare, in June. 26 states brought the act to court after it was passed, saying it is unconstitutional, specifically regarding the individual mandate. Well, we're going to talk about what the mandate means and the criticism it is facing. Interesting tidbit though, according to factchecked.org, many Republicans into the 1990s thought that the individual mandate was a good idea. And up until he was elected president, Obama was against the individual mandate. Both a stark contrast from what we see today in Congress. The Pew Research Center recently did a poll which showed that 56% of people opposed the mandate, while 41% were in favor. 3% didn't know. And a recent Gallup poll said that about 72% of people say the law is unconstitutional. Okay, what is the individual mandate? The individual mandate, or minimum coverage requirement, says that all people must have some sort of insurance. The exceptions are recognized religious groups, Native American tribes, those in jail, those whose incomes are so low they don't have to pay taxes, undocumented immigrants, and those who cannot afford it. For the purpose of the law, individuals who can afford insurance is defined by people whose minimum policy is less than 8% of their monthly income, according to the Washington Post. The actual language is below in the transcript. It's a bit long to include here. But essentially, you must have some sort of health insurance plan or you are penalized. The penalty is fully in place in 2016. Those who don't have insurance will be fined $695 or 2.5% of their income, whichever is higher. It is this part of the law that is expected to be targeted from the Supreme Court. Can the federal government force you to purchase something? There are many valid concerns here. Republicans think that this bill took too large a step in the interactions government has in our lives. They don't think that the Commerce Clause, which allows the government to manage interstate activity, provides for the measures of this minimum coverage requirement. Democrats defend this largely citing previous examples, such as the requirement of car insurance to legally drive. Both sides disagree with the effect the mandate will have on jobs, the deficit, and the economy. Speculators ponder whether the individual mandate will be struck down, whether the entire law will be struck down, or whether anything will happen at all. We will see in June.
I'm in for theft and aggravated assault.
Yeah? I'm in for murder. What are you in for?
I'm in for not buying the exact health insurance plan Congress mandated.
Whoa.